Welcome to the Clinical Competency Assessment Center for Nurses at the University of Manitoba. The CCA Center conducts assessments for international and domestic nurse applicants. It identifies gaps, and if any are present, the regulatory body can develop a plan to address these gaps so you can practice safely and competently. The College of Nursing CCA Center conducts assessments for registered nurses, registered nurse authorized prescribers, and registered psychiatric nurse prescribers. The CCA has a mix of written exams and in-person clinical assessments, or OSCEs. Written exams are completed online using a proctoring software, where the candidate is also monitored via the webcam on their computer. To meet the needs of all candidates, OSCEs are offered both in person at the CCA Center at the University of Manitoba College of Nursing, or virtually. The content of the virtual and in-person assessments are the same. If you are completing your OSCE in person, you will receive a package via email that includes your appointment date and instructions with a map to assist you in locating us. When you arrive, report to the assessment center, located on the 4th floor of Helen Glass Center for Nursing. You can take the stairs or elevator from the main level of Helen Glass Center for Nursing. An assessor will greet you, check your ID, have you power off your phone, and put away your belongings. They will then orientate you to your day, and you will be provided the opportunity to ask any questions you may have. You will also be provided orientation to the environment and have the ability to manipulate the supplies and tools. The OSCE rooms are furnished with equipment, tools, and supplies reflective of real-life practice. Depending on the objectives of the OSCE station, you may be providing care for an actor, known as a standardized patient, or a simulation mannequin. Once you are ready, your assessor will direct you to your first OSCE station, where they will provide you with the OSCE candidate instructions. You will have 3 minutes to read your instructions and formulate your plan. When your 3 minutes are up, you will enter the patient's room and complete the nursing care as indicated in the candidate instructions. Throughout your encounter, you will be monitored by the assessor, and the encounter is recorded and timed. When the time is up, you will be asked to return to the main room, where you will have the opportunity to rehydrate and refocus. And then the next OSCE will start with you receiving the candidate instructions for the next station. The process is repeated until all the stations are complete. If you are completing your OSCEs virtually, you will be engaging with your standardized patient in Zoom OSCE stations. For the RN CCA, some OSCE stations are conducted in immersive virtual reality. If your assessment is scheduled to be conducted virtually, you will receive orientation, opportunity to practice in the virtual environment, and technical support prior to your OSCE day. For both in-person and virtual assessments, you may be the only candidate, or you may be rotating through the OSCE stations simultaneously with other candidates. Once all the OSCE stations are complete, you will be provided with the opportunity to debrief with your assessor, reflect on how your day went, and self-identify any gaps you may have noticed. Following your OSCE day, the Assessment Center will provide the regulatory body with a report outlining each of the competencies, and if they were demonstrated as met or not met during the CCA. They will make an appointment with you to go over your CCA report and discuss next steps. You will also receive a copy of your report for your records. You will note that the CCA website contains links to our candidate handbooks, where more detailed information regarding the assessment can be found. We look forward to working with you. Should you have any questions, please don't hesitate to contact us.